Professor Olivier Bertrand for Interventional Cardiologist, Quebec Heart-Lung Institute from Quebec City, Canada. So I welcome you. Welcome to our institute and to TRICO 2012, the 8th TRICO conference. Sir, I have just a few questions. Starting with, kindly share your experience for TRICO 2012.
You know, this is my first time in India, and this is my first time at TRICO, and I am completely amazed by what I've seen. First of all, I would say that I was very lucky that Dr. Patel showed me the Apex Heart Institute, which I believe it's a dream came true for a very prolific man. I would say that I believe that, like my father told me, that behind each great man you have to look for the woman, and I think that he was very lucky to have his wife working and giving ideas and thinking about how to build this institute, and I'm sure that it's going to be very, very successful. I mean, I can see that he can treat any kind of disease, any kind of patients, and I am convinced that you will get the best care compared to even things that we do in my country in Canada. And now, I mean, so TRICO has started this morning, and I'm very impressed by the number of physicians. I mean, I think there is more than 500 people in the room.
Yes, sir.
People are very interested by the live cases. What I believe are very unique for TRICO is that Dr. Patel has selected very complicated cases. And we just finished a case when there is a loop and very complicated approach and access. So people could just see step by step how to do it. And, you know, compared to other courses when things are very much prepared that you always succeed. Here we have seen something very complicated. For one case, it went well. I mean, another case done by Dr. Saito, very complicated CTO. We could also follow all the steps. And we were also very impressed that Dr. Saito at the end decided that to stop the procedure. So I think even from the beginner to the very advanced operators from any countries, people can learn from TRICO, and people learn from the very specific cases which have been lined up for the 2 days conference. And so far, so good. I mean, this is very enjoyable for me, and I hope I will continue to see very interesting cases over the next few hours.
Okay. So what is your impression about the TR technique being practiced here?
Well, I mean, as you know, in my own country, we have been using the radial approach since '93, and I'm basically considering myself like a second generation radialist. The program was started by Dr. Barbeau very early on in Canada, which has been promoting radial very early. But as you know, like in India, you had like people very much convinced about the benefits of radial, and many operators stayed femoral for many, many years. So now even in countries like in the US, people have been learning from India, from Canada, from people who have been promoting radial, and I just say that the way we work for radial cases here are very similar to what we do, but basically the whole question is any cases, any kind of clinical scenario or any complex anatomical situation, we basically can do it with radial. I mean, we can do it here, we can do it in Canada, we can do it in Europe, we can do it in the US, and I think that the way things have been doing here in terms of education for new generation are an excellent example for everybody.
So how do you place it as compared to the West, the practice over here?
I think that it's basically state of the art. There's also something which is very impressive here is that the cath labs are just brand new cath labs with IVUS or CT. So we have seen here techniques that I cannot even use every day in my country because of the cost. And so I think to learn from the puncture to the procedure to the hemostasis and go back home, this is perfect.
And how about the cardiology team of Dr. Tejas Patel or the institute?
Well, that's a very good point, and I think this is very important. And you mentioned the word team, and as you know, I mean, you cannot succeed by building such a wonderful program and practice without a team. And I think that you are part of the team, and I mean, is teams of physicians, nurses, cath lab technicians, but I suspect the whole team from the hospital are an integral part of the success, and why everything is flowing rapidly and fluently, and I'm impressed. I would dream to have the same kind of people around me in my country.
And how about the cardiology team in specific?
Well, I mean, this is the first time that I met Sanjay, and I met all the previous colleague and present colleague, and I think that you can feel. I was just assisting for one of the cases of Dr. Patel, and you could feel that during the cases there were 2, 3, and they interact and they ask questions, and so there is no ego. I think, you interact for the best interest of the patient, which I believe that we should all do and practice the same way.
And Dr. Sanjay and Dr. Patel are sharing this association for quite a number of years now.
Yeah, that's like two friends working together. So basically it's fantastic.
Okay, and any message for TRICO especially?
Well, I understand that it's the first year this is transmitted from the Apex, and I think that TRICO has a bright future. I mean, I guess the number of participants, it's amazingly high, and as I said to Dr. Patel, because I've been participating in a number of courses around the world, and this is basically the biggest in the world. I mean, I do consider Dr. Patel as a friend, so it's a pleasure to come and an honor at the same time. And I think that among other colleagues which I've known for years, I think Dr. Patel has gathered very famous people around, and this is a testimony of the course. So I am sure that the TRICO will remain one of the best courses in the world and has a bright future for the next 10 years. But then maybe everybody will do radial, so we don't know what we will do afterwards.
Okay, thank you, sir. It was an honor having you here today.
Thank you.